Alright, now we'll talk about two types of fractures, and this is what is known as the femoral fractures and also the pelvic fractures. Okay, femoral fractures, pelvic fractures. Okay, so just so you know, we're talking about femoral fracture is a break in this bone that goes to join with the pelvis. Now the femur is close to the pelvis, that's why we actually discuss these fractures together. So pelvic fractures here is any fracture that affects the ring bones forming the pelvis. So both of them are actually serious injuries, and they are caused usually by different things. We'll actually look at them. Okay, so femoral fractures can be caused by high energy traumas like car accidents, you fell from a height, or low energy trauma like in elderly people. They already have a weak bone, so it's now easy for them to now have a fracture. So you understand. Then also pathologic fractures, where you're having a fracture as a result of you had an underlying disease condition. You understand? So those are the issues there. So types: you can have the fracture which is close to you, that's proximal. You can have the fracture at the shaft, and you can have the fracture which is well down. The fracture around here should be the distal. You understand? So symptoms is there's a lot of pain in the thigh, and you have inability to bear weight, and there's a visible deformity or shortening of the leg. So complication could lead to a lot of blood loss, could lead to fat embolism, long-term disability, and chronic pain. So management is you just stabilize with tractions or splints, surgical fixations where you use all those nails, plates, screws, then rehabilitate the person. So how about the pelvic stuff? This is the pelvic. So any fractures around this place, because we have subcategories of fractures around this place. So for the pelvic one, is breaking any bone that makes up the pelvis, either the ilium, the ischium, or the pubis. You understand? So it could be caused by high energy trauma or low energy traumas. So low energy trauma is mainly something that was not meant to cause a fracture, but it caused it anyway because your bone was weak. So types: you have the stable fractures and also the unstable fractures. Stable fractures, you have just one break and the bone remains aligned, while unstable one, you have a lot of breaks, the bone is displaced, it's often life-threatening. So symptoms here: there's a lot of pelvic pain or groin pain, and you have difficulties trying to walk or stand, and there's bruising, there's swelling, there's internal bleeding. Complications could lead to massive hemorrhage, because the pelvis has a lot of blood vessels there. You understand? So you can bleed a lot. Can lead to injuries to any of those organs that is within the pelvis, either the bladder, the urethra, or the intestines, and also nerve damage. So management is mainly stabilization, pelvic binders or external fixators. Then also you are looking at the area of blood transfusion because the person has lost a lot of blood. Then surgical repair if everything is unstable. Okay, so we got for these two types of fractures.